Hey everybody, Rebecca Clark here with the Institute of Orofacial Recovery and Alamedin. This is Changing the Face of Dentistry, and I'm your host, Rebecca Clark. Um, as you know, sometimes I'll go through and I'll scour the web just for educational content and also share what it is that I do here at my office in Alamedin in downtown Seattle and with the Institute of Orofacial Recovery, educating dental providers and patients alike in what it is that I do in optimal orofacial rehabilitation, orofacial recovery. When it comes to every other part of the body, the muscles of the face are grossly ignored in rehabilitation. When it comes to oral cancer, orthognathic surgery, Bell's palsy, TMJ, things like that. So today I'm going to talk to you about one of my favorite Instagram places that I follow is called Posture Pro. They talk a lot about posture in general, tongue posture, and how our bodies are performing optimally. So when I talk to my patients in my own practice, I talk to them about our bodies are a machine. And if the structure isn't going to work, we're not going to function. Just like the wheels on a car. The wheels on a car have to be straight in order for the car to continue to move forward. If the wheels are tilted at any point in time, then the car's not going to really move. So I look at the same thing with the body. If the structure is off, we're going to create an imbalance and the muscles aren't going to get us from point A to point B, and we're going to have compensations. So in my practice, I mainly focus in on adults who have TMJ and major facial reconstructive surgeries, as there's a huge drop off in post-surgical rehabilitative care. And the reason why I'm bringing you Posture Pro today, absolutely go ahead and like and follow. You get a lot of amazing education through them. One thing that stood out to me today from them is how they talked about orthognathic surgery. So I'm just going to use their post and educate a little bit more beyond what they had discussed about what I do and orthognathic surgery. So this is the Posture Pro on Instagram. This is their site. So lots of really good, amazing information. We're going to look specifically at this video here.
Maxillary osteotomy is a surgical procedure designed to change the position of the upper jaw, improving the alignment of the teeth. Typically, it complements orthodontic treatment with braces.
Yes. So to back up a little bit, so this is traditional orthognathic surgery. There's three different types of orthognathic surgery. Lefort 1 is what they're talking about here, where we take the upper jaw and move it forward or back. Lefort 2 is where we take the sinuses, it's about here to here, and bring the face forward or backwards. And Lefort 3 is where we take the entire front of the face and move it forward or backwards, usually for those who need major reconstructive surgeries. Lefort, it's another topic, but it basically goes along the suture lines. They're called Lefort suture lines in the face, and doctors try to focus in on those areas. So Posture Pro is talking about a Lefort 1. We're just moving the upper jaw forward. Most of the time when we're moving the upper jaw forward, we're also moving the lower jaw forward in order to create a nice balance with the jaws. So in any case, when it comes to orthognathic surgery, a proper alignment for especially airway is really important.
Entire operation is conducted internally, ensuring no visible facial scars.
This is the best thing that I love about orthognathic surgery is that they do everything inside of the mouth. There are no visible scars. Sometimes if they're moving the lower jaw, there might be little tiny scars here on each side. If you don't know about me, I had orthognathic surgery in 2019. Where they moved both jaws, the upper jaw and the lower jaw. And we did some surgery on the chin to bring my chin back. But this is just one part of orthognathic surgery.
The process involves making a cut through the gum above the upper teeth to access the jawbone. Subsequently, the upper jaw is precisely cut using a small saw, allowing controlled breaking to achieve the desired repositioning. This surgical approach aims to enhance dental occlusion and facial harmony without leaving visible external marks. Tongue posture is frequently disregarded in this procedure.
So I love this that Posture Bro talked about. Yes, tongue positioning is grossly ignored, and not just tongue positioning, but rehabilitative aspects. So there's over 58 muscles in the face alone that help with muscles of facial expression. And when we have this type of surgery, the doctors are doing their best to avoid muscles, traumatizing muscles. However, the muscles are still traumatized. We're moving the origin and insertion that we're overstretching in those muscles in order to provide this procedure. And a lot of the times, most of the time, with orthognathic surgery, what happens is these muscles here that help close the jaw, they're hyper extended. So they're extended too far. It's called a strain on the muscle, which can actually cause collapse in the muscle and cause trismus, or what we call lockjaw. So what I do in my practice is I rehabilitate these muscles after major surgeries. And then going back to the tongue is grossly ignored in general. And they talk a little bit more about this, and then I'll continue on when we're done.
Consistently resting the tongue in an incorrect position can lead to malocclusion and underdeveloped jaws, potentially requiring corrective measures such as maxillary osteotomy.
So, yes, tongue position is really important in growth guidance and airway in children and teens to take advantage of what the jaws are supposed to be doing. The jaws take shape of the tongue. The tongue is supposed to be resting 2/3 at the roof of the mouth consistently. If the tongue is resting at the floor of the mouth, it's more than likely also resting at the back of the throat, increasing risks for sleep apnea, sleep disorder, breathing. If you're laying back and you're feeling like your jaw is falling backwards, it's cutting off your airway, it's more than likely a lower jaw problem, not also just an upper jaw problem. So tongue positioning is really important. There's 8 muscles in the tongue, and some of them are connected into the lower jaw. And so if we're grossly ignoring the muscles of the tongue absolutely can be affected, as well as the rest of the muscles of the face.
While this surgery effectively aligns the jaw, prioritizing proper tongue posture could potentially prevent the need for surgery altogether.
So they're not wrong. Proper tongue posture, as I was saying, can prevent surgery altogether, as long as we're taking advantage of the growth guidance and growth plates. Okay. So, and that's why tongue posture, tongue positioning, if you have a tongue thrust, either an anterior or a posterior tongue thrust, or if you have what they call a tongue tie, if the tongue is physically receded down to the floor of the mouth, it can cause underdevelopment of the upper jaw and underdevelopment of the lower jaw. So what I do in my practice is pre-surgical care and post-operative care. And I also teach other providers, changing the face of dentistry, other providers in it, what it is that I do and how the muscles of the face are grossly ignored, and how we really need to come up in the dental community and take care of these patients for more long-term sustainable results. There have been studies that have shown that if we're by grossly ignoring the muscles of the face, orthognathic surgery relapse is about 30% in cases. So we definitely want to avoid that. We are looking for optimal range of motion. How wide you can actually open the jaw is really important prior to going into surgery, pre-surgical prep, and then the rehabilitation component, the lymphatic drainage, is so important after that. But that's for another episode. That's it for us today. I hope you're having a wonderful day. Happy Valentine's Day. And I look forward to speaking with you again on more educational tools.